If you dislocate your patella or your kneecap multiple times, what else can you try so that it stops happening and you can return to play sports? In this video, I discuss surgery and other options. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions that you've left me in the comments to the videos on my channel. This week's question, very simple. I'm an athlete. I've dislocated my patella 3 times. I'd like to have your thoughts on treatment options. As always, I'm not giving medical advice in this video. Like all my videos, all of the information is just that. It's there for information and educational purposes only. So the patella is the kneecap, and basically it's an injury where the kneecap pops out of the groove on the front of the femur, the trochlea, and basically pops to the outside. Now, it can be, usually the first time it fully pops out, but sometimes it can be a subluxation or partially coming out of place, but then it spontaneously pops back in. But if it's truly dislocating, it has to be put back in place either by the person, by you, or by a physician or some other healthcare professional. That's a little bit more serious. After a first patella dislocation, we're typically not going to talk about surgery, but when it happens multiple times, that's where you tend to get into talking more about surgical options. But leading up to that, as it becomes a more recurrent thing, you try physical therapy. Can be very helpful to try to prevent it from becoming a recurrent problem. And there are patellar stabilization braces that can try to prevent patellar dislocations. And they're even designed to be worn when you're playing sports to try to prevent it. They can be helpful, but doesn't always work. It depends on a number of factors. The depth of the trochlear groove. Was there an injury to the ligament? You don't see it on here, but on the inside of that kneecap, the medial patellofemoral ligament, is there a piece of bone that's been knocked off? A number of different things. But again, if physical therapy didn't work, the patellar stabilization didn't work, then you're talking about some type of surgical option. And we've progressed more into surgeries to reconstruct or repair that medial patellofemoral ligament, or do even a more aggressive treatment, sometimes moving the part of the bone to better align what we call the extensor mechanism. It's gotten a lot more involved than simply just releasing the tissue also on this side to create sort of a balance. That typically doesn't go very well. So it typically is a bigger surgery. Again, the most common one is a medial patellofemoral ligament reconstruction with or without some bony involvement. So it is a bigger deal. Typically not done after a first patella dislocation, but it's certainly after it starts happening multiple times. So I hope that was helpful. I wrote an ebook you might find is interesting, especially if you're dealing with arthritis changes in your knee or other joints. It's called the Arthritis Solution. You can get it free by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shot, there's a link in the description under this video that'll take you, if you click on it, to my contact page. You can fill out that form to learn more about scheduling an appointment with me. Now, I'd love to hear your experience with your injury, patella dislocation or otherwise. You can leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't give you medical advice. But what I do, like I did here, is sometimes I use that question as a topic for a future video. Subscribe to my channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.